Be a part of the conversation.
We can't even trust the banks with our money.
This is WSIC News Talk Now.
Hello all, and welcome to the L Show, where the L in the L Show stands for leaning in, which means that we will not shy away from any subject, no matter how taboo or uncomfortable, such as menopause, sex and libido, mental health and depression, difficulties with weight loss, and all of the other topics that are important to us maturing women in the prime of our lives. Thank you for tuning in and either watching or listening to the show. If you have any questions during the show today, please call in and we will do our best to get you on the air and get your question answered. You can call 844-STUDIO-4 or 844-788-3464. I'm your host, Dr. Nicole Eastman, and I am the owner of Rose Pharmacy and Boutique Apothecary located here in Cornelius. We are a compounding pharmacy with a focus on functional medicine, and what this means is that my team and I, we make medications that are specifically formulated for you. We also provide holistic alternatives like supplements, vitamins, and much more. You can find out more about us by checking us out at our website, roserxboutique.com, or Instagram and Facebook at Rose Pharmacy and Boutique Apothecary. I would like to introduce my guest co-hosts, Kathy Rogers, Executive Director of Mental Health America of Central Carolinas, and also Candace Wilson, Director of Family and Peer Support for Mental Health America of Central Carolinas. Candace was unable to physically come into the studio today, but I'm so glad that she was able to join us virtually because she has so much valuable information to share. Now, she'll be with us for as long as she can, but we'll have to leave us prior to the end of the show. But we will make sure we get all of that good info from her before she jumps off. First, Kathy, let's get started with you. So tell us about your background and what you do.
Okay. First of all, thank you so much, Nicole, for having us here today to talk about this important topic. We really appreciate it. I am Kathy Rogers. I'm the Executive Director for Mental Health America of Central Carolinas. I've got more than 2 decades of nonprofit executive management experience and have had the great joy of leading this organization for the past 6 years, and just in my own journey have learned so much about the importance of taking care of our mental health and self-care and all the things that we're going to be talking about today.
Wonderful. And Candace, can you also share about your background and what it is that you do?
Again, Nicole, thank you so much for having us today.
You're so welcome.
My name is Candace Wilson. I'm Director of Family and Peer Support for Mental Health America of Central Carolinas. I've had the pleasure of being part of this team for over 13 years. Throughout my career, I've had the opportunity to advocate for and with kids and families in Mecklenburg and Cabarrus counties, and have been able to use my lived experience in parenting my own children to help other parents who are parenting sometimes difficult kids.
Thank you both for being here on the show today. And today's show is not the show that I had originally planned for today. I was instead moved by a situation involving someone close to me that made me want to change gears a bit and deal with the mental health system, resources, women and men as caretakers. It's a situation that involves how we take care of those who have been determined to need mental health support by either their loved ones, their providers, and even themselves in some cases. But in this case, it is a woman who painfully realized that her loved one, her teenager, who suffers from a neurological disorder, which has led to a mental health crisis, needed more help than she could give, and that she felt could be a matter of life or death if help was not given. She turned to our mental health system for help on Monday. And up until this morning, so it's a full 5 days later, the teen had been sitting in much of what seemed to be a holding pattern while waiting on an available bed in a psychiatric facility and not getting any specific mental health treatment at all. He was released this morning due to not being able to be placed anywhere, and of course, Mom is upset. And also, as they were being discharged, Mom told me that there was no attempt at continuity of care, no discussion of next steps for Mom, medication, nothing at all. Mom had to actually go and ask for it. And of course, I'm not going to name the names of those involved or name the facility that's involved. I just want to have an open discussion with my guests who are subject matter experts, and with an organization that is trying to help with the difficulty involved in navigating through this fragmented system that unfortunately seems to fail segments of our population. These failures can lead to fatal outcomes. And although we know that the system was not designed this way, but it has got to get better and it's got to be better, what are people supposed to do? September actually marks Suicide Prevention Month. And this is a month where we are asked to remember the lives lost to suicide, the millions of people who struggle with suicidal ideation, and acknowledge the families, individuals, and communities that have been impacted. It's also a time to raise awareness about suicide prevention and share messages of hope. Undertreated mental illness can have devastating effects. So at this time, I typically, ladies, I like to share with my audience fun facts about things, but this is not a fun fact. These are not fun facts. These are statistics that we found, and they're real and they are upsetting. So according to the National Institute of Mental Health, young adults ages 18 to 25 in the U.S. had the highest rate of experiencing mental health conditions, followed by those ages 26 to 49, and then adults ages 50 and over. And according to the National Alliance on Mental Illness, the impact depression and anxiety has on the global economy can be measured in $1 trillion in lost productivity each year. $1 trillion. And suicide is the second leading cause of preventable death in the U.S. for ages 10 to 14, 25 to 34, and in ages 35 to 44, it's the fourth leading cause of death. In ages 45 to 54, it is the seventh leading cause of death, just a smidge behind diabetes. Ages 55 to 64, it is the ninth leading cause of death. And North Carolina closely follows those same statistics. Right, ladies?
Yes, very much.
So why we're having this discussion today is because ultimately we want to make sure that people do have resources. People know where to go. People know what options are available to them. And organizations like yours is there for that. I'll tell you that I didn't even know about your organization until just a few days ago when I reached out to a friend of mine and she led me your way. So thank you for what it is that you do. Nice. Is there any other statistic that we can talk about at this moment before moving on to our next segment?
I'd love to put a visual in your audience's mind about suicide rates and our response to it. What we see every day of people dying by suicide is the equivalent of an aircraft crashing and everybody on that plane dying. We would read about that in the news, but we don't read about the high rates of suicide that we see. And we sometimes get caught up in those numbers, but there are young people behind those numbers that just got a message yesterday about a 10th grader at one of our high schools who had died by suicide. So, we really do need to put an emphasis on suicide prevention and everything you just talked about a young person waiting in an emergency room for days on end. So,
thank you for that. And when we come back from break, we're going to continue our discussion. And please try to stay with us. We'll be back in just a moment.
Whatever the story,
we have to end our dependence on China.
Have your say.
This debt crisis is going to set our economy back big time.
This is WSIC News Talk Now.
Here is your WSIC community calendar. Enjoy exploring the many musical talents of others? Kane Center for the Arts in Cornelius is hosting the LKN Songwriter Showcase this Saturday. Davidson Mayor Rusty Knox will be among the performers. The LKN Songwriter Showcase this Saturday. For more info, visit canearts.org. That's CAINarts.org. Less than 2 weeks until Huntersville Hay Day. the sesquicentennial celebration for the town of Huntersville. Saturday, September 23rd from 2 until 8 p.m. at Huntersville Athletic Park. Come celebrate Huntersville's 150th birthday. Saturday, September 23rd. For more info, visit huntersville.org. Not much time left for apple picking at Kerrigan Farms. The apple picking at Kerrigan Farms is a very short window. Apple picking will end September 30th. Apple picking at Kerrigan Farms, only in September. Book your experience now at kerriganfarms.com. That's kerriganfarms.com. Have an event you would like to tell people about? Yard sales, estate sales, and everything in between? Visit WSICnews.com and click on events to submit your event today.
The Renaissance Festival is back! Saturdays and Sundays, September 30th through November 19th. A non-stop outdoor family adventure! Huzzah! Tickets available online only at renfestinfo.com while supplies last. The Carolina Renaissance Festival is sponsored by Sunbelt Rentals. For all your equipment rental needs, equipment service guaranteed. Huzzah!
And now a look at your weather update from the WSIC Weather Center. It's a beautiful Friday out there today. What a way to head into the weekend. Sunny skies and a high temperature getting near 78 degrees this afternoon. Heading into the evening hours, we're still going to have clear skies with an overnight low dipping to around 57. This has been your weather update from the WSIC Weather Center.
If you have an upcoming event, let WSIC spread the word. Go to WSICnews.com and click on the Community Calendar button. WSIC, proud to be part of your community.
Hi, and welcome back to the Elle Show. I'm your host, Dr. Nicole Eastman, and I'm here with my guest co-host, Kathy Rogers, Executive Director of Mental Health America of Central Carolinas, and Candace Wilson, Director of Family and Peer Support for the same organization. Ladies, that little synopsis that I gave earlier about the situation that led me to change the show, is this something that you hear as commonplace? Kathy, do you want to take that, or Candace?
It is. We hear quite frequently from parents who are calling, from adults who are calling about their children, their loved ones who are experiencing mental health issues, who reach out to our emergency rooms, whether they go to one of the local large hospitals, whether they go specifically to our behavioral health hospital. And we hear that individuals who are experiencing mental health crises are sitting for days, sometimes in emergency rooms. Some of our young people who are admitted to general physical health rooms in our in our hospitals are sitting there without education, without care, being monitored 24/7 by a staff member. So unfortunately, it is something that is happening across our state and in our local communities as well.
He's missing graduations, missing, as Candace said, school work, sitting in an emergency room. And, 5 days is a long time, but we know there are instances where they're there for weeks and months at a time. And, it's a capacity issue, but it's also, the mental health system's just very complex and fragmented.
And I'll put this out there too. I want to say that this particular situation involves a mother and her teen that has an illness that has perpetuated this issue. But it could just as easily be applied to an individual who is the caretaker of, say, an elderly parent with concurrent illness and mental health issues? Or what about the situation in which an adult is not only taking care of a child with mental health issues, but also a parent, same time, with mental health issues? What are families up against?
So I heard someone say that entering the mental health system is like being sent on a cruel scavenger hunt.
Wow.
And that just struck me as so
Mm.
hard if you do have a child or a
Mm-hmm.
loved one who is dealing, number one, they're in crisis, which means you're in crisis. And that's why Candace and her team are so important to help parents and caregivers deal with the mental health system, but they can't change what's out there and what's available. They can only do their best to help them navigate the complex system. So I'll let Candace talk a little bit more about that.
Some of what folks are experiencing is because there's not one direct door into mental health care in our community. Some people find their way through their primary care physician or their pediatrician. Others find their way through school counselors, some through clinicians in the community, and some just call places like ours. They'll call Mental Health America of Central Carolina saying, I don't even know where to start. And hopefully, I mean, Kathy, unfortunately, your description was so accurate that it's very fragmented. We also know that as adults are trying to find help for their adult children or for an aging parent, if the individual mental health crisis is such that they can't make good decisions for themselves as it relates to their mental health care or physical health care, sometimes that that family member trying to help them, their hands are truly tied because the adult individual can make their own health and mental health choices.
I was going to mention, Candace, once a child gets over 18, it is hard for the parent to get information or to intervene on
their behalf,
because they're still our children and we're still trying to help, but it increases the barriers that parents have.
Well, why is it so difficult? Why is it so difficult to get through the system when we know how important it is to get to people early so that we don't run the risk of it ending in a life that could have been lost, that could be lost to suicide?
Sometimes we don't even recognize that there is an issue. So then it's too late once someone takes their own life or goes to that level because they're in so much pain. There are a lot of reasons why it's difficult. We don't have the capacity. We don't treat mental health the same way that we treat physical health. So, if you go into the emergency room with a broken arm, you're triaged and, taken in to get the care that you need. But, there simply is not the capacity at these hospitals to deal with the number of, especially young people who are coming into the emergency room. So there are some good things happening. They're just not happening quick enough. And we all need to be advocating for, on our local, state, and federal level, to support increased funding for mental health, whether it's in our communities or in our schools. The state legislature mandated school-based mental health, but it was another unfunded mandate. They didn't put funding behind it. We need to start investing in mental health systems in our communities.
Tell us more about what Mental Health America of Central Carolinas is and how did it get started?
So we're celebrating our 90th anniversary this year.
Happy anniversary, wow.
So, and we serve Mecklenburg and Cabarrus counties, but during the early 1930s, around that time, a whole movement, and it was known as the mental health hygiene movement at that time, which is a weird name for it, but Clifford Beers, who had actually experienced the mistreatment in the hospital because of his mental health, launched this movement to improve how we care for people in a caring and compassionate way. We're part of a national organization. All of all MHA affiliates are different because we respond to our community and our community's needs, and all communities are different. But our national symbol is a bell because in the 50s, a call went out to institutions to send the shackles and the chains that people used to be chained up by, and they melted all this down and cast all these chains into a bell, which has become really a symbol of hope. So you think about how bad it is today, but it has improved.
Right.
You know, we don't lock people up, but we still have so far to go. A lot of times, the first time people encounter the mental health system is in the back seat of a police car.
That's so sad.
I had a call from a lady the other day, and she wouldn't tell me her name because she was worried I was going to call the police. And, you know, I'm
so
reassuring her, I'm not hearing anything that makes me want to send someone out to. And the only time we would do that is to help someone. But you know, Candace, I've talked a lot, but stigma can really be a barrier to people getting help.
Candace, your thoughts?
Kathy, you summed it up beautifully. I would add that we have seen our communities respond in a better way, but psychology and psychiatry is not a black and white science. And so you only see the pieces, or the mental health professionals only see the pieces when their patient shares. And sometimes it's not a complete picture. And sometimes it takes as many as 10 years to truly get an accurate mental health diagnosis. And imagine being the parent of a child that you know something isn't right. You've reached out for help. You'll get one diagnosis and then try some medication or some new form of treatment. Then you see a different mental health professional, and because of what you share at that, you get a different diagnosis. And so many individuals get this long list of mental health diagnoses. That's not to say that at the time they were presenting that information that it wasn't accurate, but psychology and psychiatry is not black and white. And sometimes people just get so tired of being told something different that they just give up.
Yeah.
And as women, we're very often not believed.
That's
when
correct.
we go to see our primary care physician, we might talk about being sad or depressed or having a degree of anxiety, particularly around the time that we have, if we've been blessed with children. We are seeing more frequently that physicians are really listening and making sure that women who might be experiencing postpartum depression or anxiety are getting the treatment that they need. But for many, many years, it was just written off. And
very true.
Stigma, as Kathy said, is such a big part, regardless of the culture that we come from. There is stigma in every part of our culture in our country, and people don't want to talk about their mental wellness. We'll talk about our physical ailments, but we won't talk about those emotional ailments.
Because we're concerned about what that's going to do. That's going to be written on paper. It's going to follow us, all of those things.
Or how I'm going to be seen.
Exactly. All right, guys, when we come back, we are going to continue this very important conversation with my guests. We'll see you then.
Conversations that matter.
I gotta tell you, I'm afraid to even think about the next presidential election.
Led by you.
It's a mockery of American politics.
This is WSIC News Talk Now.
When you can't stop, there's Vicks VapoRub. Vicks VapoRub sends powerful medicated Vicks vapors right to the source of your... so you can experience cough relief and breathe easier. Generations of families have trusted Vicks VapoRub to help relieve the worst cold symptoms. So next time you have a cough, reach for the Vicks VapoRub. Vicks VapoRub. Cough relieving is believing.
For the ones who work hard to ensure their crew can always go the extra mile, and the ones who get in early so everyone can go home on time, there's Grainger, offering professional-grade supplies backed by product experts so you can quickly and easily find what you need. Plus, you can count on access to a committed team ready to go the extra mile for you. Call, click Grainger.com, or just stop by. Grainger, for the ones who get it done.
And now a look at your weather update from the WSIC Weather Center. It's a beautiful Friday out there today. What a way to head into the weekend. Sunny skies and a high temperature getting near 78 degrees this afternoon. Heading into the evening hours, we're still going to have clear skies with an overnight low dipping to around 57. This has been your weather update from the WSIC Weather Center.
eBay Motors is here for the ride. So minivans, sedans, JDMs, roll out. Go ahead, feel your engine. Admire that perfectly installed exhaust. Your vehicle's moving along this freeway like it was made from fresh installs and a whole lot of love. And with eBay Motors, you get over 122 million parts to keep it running. And with eBay Guaranteed Fit, they'll be the perfect fit every time. Plus, at these prices, well, we're burning rubber, not cash. Keep your ride or die alive at ebaymotors.com. Eligible items only. Exclusions apply.
Discover credit cards automatically double all the cash back you earn at the end of your first year, which means... Wait, hold up. Question for the audio engineer.
Go ahead.
Did I read that right? Discover automatically doubles all your cash back?
Yeah, that's what the script says.
About
so
1 minute.
if I get a Discover card right now, I can earn twice the cash back.
Apparently. Wait! Unlimited first-year cash back match. Only from Discover. See terms and learn more at discover.com/match.
In life, we plan for many important things. Weddings, our children's education, retirement. A celebration of life is really no different. Planning and paying for your life celebration in advance will give you and your family valuable peace of mind. We'll help you take care of every detail with professionalism and compassion. We're Bunch Johnson Funeral Home. Find us at dignitymemorial.com.
Listen up, Carolinas. It's Jeep Adventure Days at the #1 Jeep and Ram dealer, Lake Norman Chrysler Dodge Jeep Ram. Our new dealership has the largest new Jeep inventory in the country, and we guarantee to beat any deal in the nation. I-77 exit 28, LakeNormanChrysler.com.
Be a part of the conversation.
We can't fix America's debt by starving its people.
Have your say.
One shooting after another, and we're doing nothing to solve it?
This is WSIC News Talk Now.
Welcome back to the Elle Show. I'm your host, Dr. Nicole Eastman, and I'm here with my guest co-hosts, Kathy Rogers and Candace Wilson. When we went to break, Candace made a really good point around stigma and the mental health system and us really being concerned about what it's going to look like for our futures. How is it going to, what we say, how is that going to impact? That's going to impact us. You know?
Exactly.
So I think about something as simple as insurance. When you're getting life insurance, something that I realized some years ago when you're getting life insurance, that if, you say certain things, if they see something in your record, that could possibly, cause it to be a little more difficult for you to get the coverage that you need,
or taking medication, or and quite frankly, that's discrimination, and that's what we have, a lot of discrimination and people feeling shame and blame, and we exist. Our vision at MHA is to eliminate the stigma, that not reduce it, and that'll take a long time, but just today, having this conversation with you, Nicole, is helping with that. Every time we can normalize the conversation about mental health, we're reducing stigma in our community.
Well, you guys are amazing, absolutely amazing. Are there other branches of MHA?
There are other affiliates across the country. We are the largest, actually, MHA in North Carolina.
Okay.
In some states, there is a state organization, and in some ways we service that from an advocacy standpoint. We work with other organizations across the state, and we work on the federal level. I was on a call yesterday with one of the aides for one of our senators up in Washington trying to get some support for the Peer Support Act. So there are we're just all different, though.
I got you. I got you. What are some of the things that you find are helpful for a parent or loved one that just need to know what they're going to face when they're going down this road? Are there any sorts of things that you think would be helpful for them to know? Candace?
So one of the things that Mental Health America of Central Carolina provides through our Parent Voice program are family partners. Family partners are individuals who have lived experience. We have raised or are currently raising our own children who might have a behavioral, emotional, or mental health challenge. We get additional training and information and knowledge, and then we can be there to provide that peer support to other parents in the community.
Okay.
We can help them get connected with the resources that they might need. We can help by offering a story of hope that there is help, that there is a better tomorrow, that there can be better outcomes for their families as well. So having that person to walk beside you, to help you navigate, to teach you to be a better, stronger advocate for your own family makes a world of difference. When my own son was in school and needed an individualized education program to meet his educational goals, I went to those meetings alone. And as I was in those meetings, I was thinking with my heart, because this is my baby. But
That's what we
going
do.
with a family partner or an advocate next to me who cares about me and my child, but knows the mandates, knows what school systems could and should do, and can help us speak up, makes a world of difference. And so we have the opportunity at Mental Health America of Central Carolina is to provide that individualized parent peer support to parents in Mecklenburg and Cabarrus counties. There are other family partners who work across our state and nationally who are there to help parents in navigating what it might be. There's another organization called NAMI, the National Alliance on Mental Illness. They do an amazing job
Yes.
in providing that peer support as well to families of adult children who are experiencing mental health issues, and providing that support to the parents and or spouses of the individuals who are struggling.
So one thing that I think that we sometimes don't consider, it's the caretakers themselves. So, we focus on the person needing the help, but we don't think about the caretakers, what sort of help they need. How do they take care of themselves? In these situations, it can be so exhausting for them. Does Mental Health America provide resources for the caretakers themselves as well? Like how to take care of yourself during this time?
We certainly do. We
That's
talk
wonderful.
about that, the need for self-care for ourselves all the time. Because if mama ain't happy, ain't nobody happy. We need to make sure
That's in all
that
kinds of
we are
situations.
well, that
Yeah.
we have the energy to be able to continue to be there for our kids, for our families. So we are big proponents. Self-care is not something that is a luxury. It should be one of your basic needs.
Yeah. And
Self-care doesn't always have to be something expensive.
That's right.
It could just be taking a few minutes to take a nice shower, or to just have a few minutes to breathe and meditate. Of course, there are more expensive things you could do as well, but self-care should be a part of all of our routines. And
often, Candace, again, we don't think about mental health as part of our physical health, but so many times it is. Just, when you're a caregiver, you really do need to focus on your physical needs. Are you sleeping enough?
Yep.
Are you drinking enough water? Are you eating,
That's so true.
healthy foods, nutrition? And again, I think especially women, we
Oh,
often
yeah.
think that self-care is selfish, and it's not. If we
Yes.
don't,
That is so true.
we were talking earlier about
Yes.
that flight attendant on that plane
Yeah.
who,
Yeah.
is telling you to put the oxygen mask on yourself before you put it on
Before.
your child. Because if you don't take care of yourself, then you can't take care of anyone.
We're
So,
suffocating, trying to
yes.
take care of other people.
And we should, if we're a caregiver for a parent or child, we need to be asking for help when we need it and not trying. I think sometimes we try to be super women
That's true.
and men too,
That's
who
true.
are caregivers. But I'm a big believer in exercise, just getting out and taking a walk. This weather we're having right
I
now
know.
is just energizing
It's
to
amazing.
me. So,
Mhm.
and we do a monthly event. They're just 30 minutes. They're virtual, called A Shot of Espresso.
Okay.
And we always have someone who comes on just sharing a technique that they're using to, manage their anxiety or depression or just help with their own mental health. We've had different ones talking about tapping or other different techniques, breathing, just those things. I know I go through the day and go, did I breathe today? It's like
Yes.
taking that deep breath. So I think that at MHA, we are trying to educate employers and educating children, different people, the importance of self-care. And because 1 in 5 of us, maybe it's 1 in 4 or more now, will be diagnosed with a mental health diagnosis.
That is scary.
But 5 in 5 of us have mental health, and we
Wow.
need to be taking care of that. So,
I agree. How often do you guys find that you're having to convince folks that it's okay to ask for help as well? Like that.
all the time. I mean, as Candace talked before the break about stigma, I mean, that's one issue is, trying to eliminate that barrier of fear. And we're constantly educating the public about, we teach a lot of QPR, which stands for Question, Persuade, Refer. It's a suicide prevention training.
Okay.
And you can go on our website. We're offering these all the time. They're free. We would love everybody to take this class because it talks about, stigma and the language that we use. Often when somebody gets diagnosed with a mental health issue, that's their label. They're
Yes.
bipolar, they're schizophrenia. It should be, I'm a person living with bipolar disorder.
Correct.
They're not addicts. I'm someone who has a substance abuse disorder.
Correct.
Turning that language can do so much
I agree
to
with
help
you.
people. We don't say that person is cancer.
Yes.
They are living with
They
cancer.
are living with cancer.
So,
Correct.
yeah.
Correct. And there are a number of resources that are available that you all have been so gracious enough to share with us. And we are posting a few of those links on the mental health resources through WSIC News and also on my website at rosarxboutique.com in my blog section. So please check those out. And we will continue our discussion when we are back from break.
Bye so fast.
Be a part of the conversation.
I listen on the way to work.
Have your say.
It's more than just opinions, it's facts.
This is WSIC News Talk Now.
Yes. So you know what I should have done? I should have thanked her on the air for coming in. I'm so sorry about.
Oh, no.
Yes,
You're amazing,
but
Candace.
definitely thank you, Candace. So informative. Again, I've seen you in action at this point.
Yeah.
So I appreciate that and all that you shared. I'm going to make sure we have people like using you guys as a resource because, again, I had no idea. I had no idea.
Well, glad you now know about us. It's been a pleasure. You all have a terrific weekend.
Yeah, you
and
too,
You do the
I hope to
same.
see you soon.
Yes.
Thank you, Candace.
Thank you.
Bye.
Bye, y'all.
Bye.
Thanks.
8 p.m. at Huntersville Athletic Park. Come celebrate Huntersville's 150th birthday, Saturday, September 23rd. For more info, visit huntersville.org. Not much time left for apple picking at Kerrigan Farms. The apple picking at Kerrigan Farms is a very short window. Apple picking will end September 30th. Apple picking at Kerrigan Farms, only in September. Book your experience now at kerriganfarms.com. That's kerriganfarms.com. Have an event you would like to tell people about? Yard sales, estate sales, and everything in between? Visit WSICnews.com and click on events to submit your event today.
The Renaissance Festival is back! Saturdays and Sundays, September 30th through November 19th. A non-stop outdoor family adventure. Huzzah! Tickets available online only at renfestinfo.com while supplies last.
Mention the Renaissance Festival and receive discount hotel accommodations at Hampton Inn and Suites, Huntersville and Lake Norman. Huzzah!
And now a look at your weather update from the WSIC Weather Center. It's a beautiful Friday out there today. What a way to head into the weekend. Sunny skies and a high temperature getting near 78 degrees this afternoon. Heading into the evening hours, we're still going to have clear skies with an overnight low dipping to around 57. This has been your weather update from the WSIC Weather Center.
Stop dreaming about the perfect lawn and make it a reality. Drum Landscape Supply now offers personalized lawn plans. Visit drumlandscapesupply.com and collaborate with our experts. Drum Landscape Supply, your local one-stop landscape shop.
If you have an upcoming event, let WSIC spread the word. Go to WSICnews.com and click on the Community Calendar button. WSIC, proud to be part of your community.
Hello and welcome back to the Elle Show. I'm your host, Dr. Nicole Eastman, and I'm here with my guest, Kathy Rogers, Executive Director for MHA of Central Carolinas. And Candace Wilson was with us. She had to jump off, the Director of Family and Peer Support. Very helpful, and thank you again to Candace for being on the show. We've talked about a good little bit today. I wish we had time to talk about more because there's just so much. But Kathy, what advice would you give our listeners who may be having difficulty, getting help or navigating the system?
I would recommend that they call us. We do have a mental health navigator who answers the phone. She's brand new, so she's still getting her feet, but she's also bilingual, so we're really excited to have her on board. And we have always prided ourselves on being able to provide a listening ear and compassion and not just, trying to get someone off the phone and providing that warm handoff to individuals who need support. We just opened in January. We're so excited, a free counseling center for really serving those historically marginalized communities. It's for anyone who's uninsured, or we're finding even people with insurance often can't afford to pay a copay. So if you come to our counseling center and we can't help you, we'll try to connect you to resources. So even coming in, and Mariel, our navigator, is actually the person who answers the phone, but she's the first person you meet when you come into the counseling center. So that's on at 3701 Latrobe Drive, Suite 140. And we are actually providing interns from Johnson C. Smith University and UNCC the experience to be our counselors, because we want to serve these marginalized populations, but also increase the pipeline of clinicians of color. So we're doing our little part to help these amazing students
Mhm.
get the experience they need to become a counselor, a therapist, open their own practice at some point. So
Right.
it's been a great added resource that we've been able to put in our toolbox.
That's amazing. Thank you. Thank you for that. And I hope that today's show has been helpful and also shed some light on the very difficult and deep subject of mental health and the crises that caretakers or individuals themselves can be faced with, not knowing how to take the first step to get help or not knowing what that first step is, not knowing resources that can help both the caretaker themselves and the individual that they're trying to get help for. I go back to that situation that brought us here today with this young person sitting in a hospital and unable to get the help that their mother wants to give them, that their mother needs to give them. If we can passionately and with unwavering determination get to our youth and help them get the treatment and tools that they need to become productive and contributing members of our society, we have made a huge step in making our communities better in the future. If we also, with that same passion, meet the caretaker, the one who has reached out and said, I need help, meet them where they are and provide support and education, resources, they in turn can help create an environment of care for not only themselves, but for their loved ones who need that additional level of support. Who better to help than someone who cares and loves them? And even with more passion, spread the resource tree to as many groups, organizations, and individuals as we can, and let them know that there are options and they are not alone. Make it easy to ask for help. Today's show is really about humanity, empathy, compassion, and grace for those who are mentally ill and for the loved ones who care for them. Our mental health system is challenged and fragmented, and we do have to do better. Thank you to organizations such as MHA of Central Carolinas for doing what you do to help communities in need and helping to navigate what can be a very frustrating time for people in need. And I say thank you to Steve Smith, the former Carolina Panther who created under his family foundation the Smith Family Behavioral Health Urgent Care in Charlotte as an alternative to going to the ER. It is open 24 hours a day and 7 days a week where they triage. They triage you the same way they would triage someone coming in for a physical urgent need. They triage people with mental urgent needs. And I looked on their website. It's amazing. Just a beautiful thing. So thank you to organizations like MHA and folks who put
there is hope.
Yes, that there. Thank you. There absolutely is hope.
Yes.
And I'll say this as well. People should try to get involved, see what they can do to help. This is open. This situation has opened up my eyes. I wasn't completely not aware of it, but it's just because it's not in front of you. Sometimes it's out of sight, out of mind. We need to do a better job of making sure that we keep these things front of mind. And how can we help?
That's right.
What can we do? And today, thanks to everyone who has tuned in to this week's segment of the Elle Show. Of course, I'm your host, Dr. Nicole Eastman, pharmacy owner of Rose Pharmacy and Boutique Apothecary, and a huge thank you to my guest host, Kathy. Kathy, where can people find out more information about MHA? Again, what's that website?
I would recommend that they go to our website and they can find everything they need to know about MHA and other mental health resources besides us. It's www.mhaofcc.org.
Okay.
Tons of resources.
And we're going to have that on the website. We already have that on my website, and also WSIC News is going to put that link there as well. And for those of you who missed any part of this show or any of our previous shows, you can always find them on WSICnews.com, or you can watch by following them on Facebook. And we're also on Apple Podcast and Spotify. This is our 11th episode, and we would love to hear your thoughts and feedback and any topics, ideas, or questions that you have. You can call the studio at 1-844-STUDIO-4 or 1-844-788-3464. And I'll mention this as well. We did not discuss all of the resources that, I have listed, but there are so many, and it would behoove people who are listening to us today to take the time to go and just do some research. Look at what's available, because there are people listening who are struggling.
And I would just lift up the number 988, which
988.
is the new, no longer have to dial 1-800 number to get the suicide crisis line. There's now a national 988 network, and you can get quickly connected to someone who can provide you some counsel over the phone and connect you to resources.
So 988, and that replaced the 1-800
suicide prevention line.
Gotcha. Okay, that is very good to know. And again, that is one thing that we will also have on our website for our listeners and our viewers. I once again, as always, invite you all to come and visit Rose Pharmacy at the store, 20035 Jeton Road, Suite B in Cornelius, and we are directly behind the McAllister's Deli and Circle K. We do have so much to offer and can personally help you with your healthcare journey, no matter where you are on that road. And when we have partnerships like with MHA, we can expand that offering and get you in touch with who you may need to speak to for anything additional that, of course, you need. We're here. We are a team, and we're trying to make sure that you live the best life that you can. You give the best life that you can to your loved ones, no matter where they are as well. So, ladies, as always, I ask you to just block off that 3 to 4 p.m. time slot every Friday for the L Show, so that together we can end our week very positively and lifting up one another, celebrating one another, and helping one another to be better. As always, thank you for the support that people have shown already for the show and continue to show for the show, and for organizations like MHA agreeing to actually come on the show to share more about what they offer. The show is about resources and allowing people to know where they can go, what they can do. And just really quickly before I end the show, anything else that you'd like to just call out to our listeners?
I just want to emphasize that if you are struggling or you have a loved one struggling, don't hesitate to reach out for help. And again, 988 or calling MHA, just to get connected to resources. We have a slogan, before stage 4. That's kind of what we live by. We don't want people to wait until you were at stage 4 and with a cancer diagnosis to get help. So, and the same with mental health. If you're struggling, therapy's okay, medication's okay. Your spirituality and self-care, all of those things are important to your mental health. So biggest piece of advice is don't hesitate to ask for help when you need it.
Wow. I hope everyone was listening to that. No matter what, listen. And thanks again to all of our listeners and viewers. I can't wait to spend this time with you again next week. Have a fun and safe weekend.